Okay, hello. I'm going to be presenting my capstone project as far as I've gotten it so far. I do apologize. My Zoom on my iPad will not let me record, so I'm currently recording it on my phone, and then, but we'll still be presenting on my iPad using Zoom. I don't know why it's being weird, but hopefully it works out okay. Let me know if I need to change it or anything. Okay. So I'm going to be talking about relationships in healthcare. This is what I've been studying for my capstone project, and primarily I'm focusing on how we can integrate personal relationships into the healthcare field to make the healthcare field a better situation for people to be in. And my name's Trinity, sorry if I did not say that. Okay, so as we begin, I want you to really think about what makes a good doctor for you as I go throughout this presentation. There's many things that people have said make a good doctor for them. It could be their level of expertise, how many years they've been working as a doctor, how they treat you as a person, how quickly they respond to you, things like that. For me personally, I've been to the doctor for a couple of different health concerns. And I really, really value it when the doctor actually listens to how the diagnosis is affecting me. One example, I've had migraines since I was a 3-year-old, and I actually go to a doctor who specializes in migraines, and migraines affect everyone differently. Some, they get the really blurry vision, just a really bad headache. For me, I actually get really, really nauseous and used to throw up, and he listened to how that affected me and changed my medication so that I was benefiting from it on the nausea side, not just the headache side, and that is really, really meaningful to me. So going into it, the healthcare field is defined as a collection of businesses that provides medical services, equipment, drugs, insurance, and other goods and services related to healthcare. And I actually took this right from Merriam-Webster dictionary because it ties into what I want to talk about. The healthcare field is a very complex field with dealing with both the needs of a big company and individuals who are just looking for answers to why something is wrong. And I think that this definition does a great job of explaining that. I mean, you're working with equipment, services, insurance, and just the patient that is actually looking for help. One way to help this patient, who is just kind of a small part of this really big industry, is to provide person-centered care. And we are going to talk about more what the definition of person-centered care is later in this presentation, but this need for person-centered care can mostly be done by using emotional intelligence, which we will also talk about, and then diving deeper into empathy specifically. So what is emotional intelligence? And I included this picture. Oops, sorry if you can't see it. There we go. I included this picture because it kind of sums up all the big aspects that make up just emotional intelligence. So one is self-awareness, one is empathy, motivation, self-regulation, and social skills. So emotional intelligence itself is defined as the ability to understand and manage your own emotions and recognize the influence your emotions have on others. And I think this definition just really speaks to all these things here in this picture. Specifically for me, self-awareness and self-regulation. You might have certain emotions towards someone's something someone says, but you have to self-regulate yourself and not just let those emotions out sometimes because they may not want to hear it. And I think also motivation talks about this as well, because what is your motivation for saying something to someone? Is it to hurt their feelings? Because in the healthcare field, that can't really be done. So using emotional intelligence in the healthcare field can encourage others to share their feelings and emotions. I think this is super important in the healthcare field because a patient may think they're a wimp or something like that, and they don't want to share exactly how this disease that they're there for or injury that they're there for is affecting them. And utilizing emotional intelligence so that they do feel comfortable sharing is a really, really good thing for a healthcare professional to have. It can also allow you to react in an appropriate way when emotions are shared. I think within the healthcare field, emotions are being shared all the time, and there could be some really, really sad ones, but it may not be professional for a healthcare professional to cry when those emotions are shared, and so they must exhibit this emotional intelligence to kind of hold in those emotions till later. It encourages vulnerability, which kind of with the first topic, it invites patients to share exactly how they're feeling and how they need help. And it's also able to dive deeper into the problem. We'll talk about later, emotions kind of affect problem solving. And so when you have this emotional intelligence and are able to either hold back or let out certain feelings that are needed, you're able to get into the problem solving skills deeper and help to solve a problem that someone may be presenting at a healthcare setting. So specifically, I would like to talk about empathy here in this big, vast thing that makes up emotional intelligence. Empathy is basically putting yourself in someone else's shoes. The actual definition is the behavioral aspect that has been added to the everyday practice of the healthcare professionals, but really it's just how would I feel if I was dealing with this? And utilizing empathy has shown to relieve stress in both the healthcare professionals and the patient who is presenting. I think you can probably say from personal experiences when someone doesn't just like say, oh, that sucks and moves on, but actually empathizes with you, it makes you less scared of your problem a little bit and makes you feel understood. It can also allow the professional to become more self-confident. If you're actually like thinking like, how would this affect me? How would I feel if I had this person's problem? The healthcare professional is more likely to want to solve it more and be confident in their solving there. This improves person-centered care, which again, I promise I will define in a later slide. Oops, sorry. And yeah, so basically I included this chart here to show the subscales of empathy. And you can see here self-perception and self-expression are on there, which goes into self-confidence with the healthcare professional. And then stress management, both in stress tolerance and optimism is there, and as well as decision making, which we also kind of talked about with self-confidence, but on the last slide I talked about how emotions can influence behaviors, so we will get into that some more. So now I want to dive specifically into the patient-doctor relationships. And here we go, I'll finally define it. The ideal relationship between that of a patient and doctor is person-centered care, and basically what that is a healthcare professional's capacity to understand the patient's healthcare concern on a personal level without bonding with them. And like I said before, this includes empathy. That's where that personal level comes from. And it's really important to know how to approach a person's problem. I think the emotional intelligence comes in when not bonding with the person. I understand you want to be personal with your patients and everything, but they shouldn't be your very best friend. And I don't know about you guys, but I'm not best friends with any of my doctors. And I think it's important to have those boundaries between professionalism and personalization. So yeah, it's important to remain professionals. And like I said, emotions can affect decisions made for the patients, and this has been shown in research studies. So being able to control those sad emotions or let out those happy emotions or the problem-solving skills can really, really affect how the doctor tackles the problem that they are presented with a certain patient. Along with just this, emotional intelligence and empathy can actually improve retention of employees. Retention of employees in the healthcare field is a pretty difficult task due to burnout, difficult schedules, heavy topics at work. I don't know about you, but I think there's lots and lots of hard topics in the healthcare field, and I personally work as a hospice CNA, and I know that I have dealt with many losses, and it's really hard because I do make personal relationships with my patients that I see, and it can be hard to lose them sometimes, and I think in any specialty that can be a really difficult thing, even if just someone's hurting and doesn't necessarily pass away. So it has been observed that emotions are contagious, and a leader, a doctor with a happy disposition is much more willing to work with their employees and much more good to work around because it lifts up the environment of the entire clinical space. It has also, I didn't put it on here, but humor is a really great way to kind of deal with those heavy topics. I know it's hard to joke about dark things, but sometimes that is some people's coping mechanism, and they need that humor to actually get through what they're going through. As we can see by this graph here, the rates of turnover among clinicians and staff with and without burnout are shown. And I want to look specifically on clinicians because that's more where I'm focusing, but you can see there's a drastic increase between the turnover rates when people are burnt out rather not. And I think utilizing emotional intelligence and empathy with your employees can help them to become more respected in their jobs and want to stay there for a longer period of time. And I wanted to highlight just one specific statistic. Primary care clinicians and staff in office practices reported a 53% turnover during a 2-year period, and I think that is pretty astounding. More than half of clinicians and staff are quitting within just 2 years, and that really, really just goes to show how hard it is to remain in the healthcare field sometimes. And I think utilizing these personal aspects can really drive that number down. So in conclusion, there are many benefits to medical professionals applying emotional intelligence and empathy in their work. Stress reduction between both them and the patient, improved self-confidence, which leads to better practice and better results, increased retention of employees, which is always a good thing. I think it's so important to have healthcare professionals and to make them feel wanted. And also increased trust with patients, which will help to really drive into the problem and understand how the patient is being affected by their problem that they come and present with. In the future, I would like to research more background research for sure, but I would also really, really want to interview healthcare professionals to get their firsthand perspectives of how they utilize emotional intelligence and empathy, and also if their schooling even taught them how to use emotional intelligence and empathy. I don't think that it's taught right now, but I would be really, really curious to know what other doctors say. And yeah, there are my references. Any questions? Okay, thank you so much for listening to me, my presentation, and I hope you enjoyed it.